Here are the top 3 signs that I use as a spine specialist to determine that my patients don't need surgery. Number 1, mild symptoms. Low levels of disc-related symptoms are not a compelling reason for surgery, whether it's pain or weakness. If it's mild and stable, you have an endurable circumstance and should focus on getting high-quality therapy rather than opting for surgery merely because your symptoms have been going on for a long time. For one thing, mild symptoms have a higher success rate with therapy. For another thing, the risk to benefit calculation generally does not favor going under the knife. The risk of a poor surgical outcome making your overall condition worse is simply not worth it. Number 2, back pain. This one may sound confusing. Your first thought might be that disc surgery is to get rid of back pain, right? But the truth is disc surgery is much better for relieving nerve symptoms in the leg than back pain. A decompression surgery such as a laminectomy is focused on removing disc and bone fragments to take pressure off nearby nerves. It doesn't significantly address pain from other tissues such as the vertebral body, the disc itself, and the facet joints. If back pain is your only symptom and you have no pain below the belt, a decompression is a medical Hail Mary. Number 3 is variable pain levels. This is the most important sign. Variable pain means your pain intensity changes throughout the day. Perhaps it's worse in the morning and much better by the evening. Better yet, perhaps your pain is entirely predictable based on activity. For example, some disc patients only feel pain when they bend their spine forward. No forward bending, no pain. Engineering the pain out of your life with better movement is the highest benefit to risk approach to treat this circumstance. If you have pain-free periods, that's a great sign. Disc injuries are generally episodic in nature. Symptoms ebb and flow primarily as a function of activity. So sitting too long, forward bending, and carrying heavy things are common triggers. One mistake I often observe is that a bad disc flare can be so intense that my patient forgets that they had months of relief beforehand. But in the absence of red flag symptoms, a disc flare is not the time to get surgery. The biggest regret I see in post-surgical cases is when there's a bad outcome on a surgery that should never have occurred in the first place. I see patients sign up for surgeries when they're in the middle of a flare and then proceed with the surgery anyway, even as the flare symptoms are winding down. Work closely with your clinician to get the right diagnosis and complete additional high-quality rehabilitation. And if you feel stuck, that's the moment to get a second opinion. I'm Dr. Jim, helping you decode the disc one concept at a time.